When it comes to spaces, a lot of people are not so concerned about it. In fact, some people see it as a thing of beauty. But for some, they are so bothered about it that they try to seek options to close the gaps. So in today's video, we'll be talking about what diastemas are, the common causes, and the possible treatment options available. So what is a diastema? A diastema simply means a space or a gap present between your teeth. These spaces can actually form anywhere between your teeth, but they are much more common between your two central incisors. Some gaps are actually small and barely noticeable, while some can actually be quite large and can be a cosmetic concern to some people. With regards to spaces, in younger children, especially in the milk teeth stage, there are actually natural gaps available, but these gaps tend to disappear once the permanent teeth come into place. The most common cause of a diastema is when you have a thick fleshy tissue that runs through the middle of your teeth, connecting your lip to your gums. Now, due to the thickness of this tissue, it actually acts as an obstruction, pushing your two central incisors apart. This prevents them from meeting each other, thereby creating the gap. Now, gaps can actually form, for example, when people have small sets of teeth compared to the size of their jaw. As a result, the teeth tend to be spaced too far apart, thereby creating the spaces that they experience. The size of your teeth and the size of your jaws are actually determined by genetics, so that means it runs in families. If your parents have them, definitely you will have it. You can actually have a situation whereby a tooth is impacted or just maybe congenitally missing, meaning that it never formed. This will eventually result in a gap. If you've had a gap all your life, then that means it is genetic, meaning that it was passed down to you by your parents. But if you've never had gaps before and you suddenly notice some gaps between your teeth, then you should be concerned, as it could signify a much more serious issue like gum disease or periodontal disease. In this case, the inflammation that arises actually affects the gum and the bone that supports your teeth. Now, as this progresses, it can lead to bone loss, which eventually affects your teeth because the teeth tend to drift apart, and as they drift apart, it results in a space. In worst case scenarios, especially when it is not treated on time, it can actually lead to tooth loss. When it comes to treating gaps, for some people it's nothing much more than a cosmetic concern. In fact, in some cultures, midline diastemas are seen as a beauty symbol, with many people actually requesting for gaps to be created for them. That being said, the treatment of a midline diastema may or may not be necessary depending on the underlying cause and the patient's concern. For smaller gaps, you can actually have a cosmetic procedure like composite bonding or veneers placed. They are actually used to fill up the gaps between your teeth, but they are, however, only limited to small gaps. You can't use them to fill up bigger gaps, because the bigger the gap, the more unnatural it will look. Your teeth will end up looking so big and very weird. For much more bigger gaps, orthodontic treatment will be a better alternative. Now, this can be in the form of traditional braces or clear aligners. For better space closure with orthodontics, if the midline diastema is due to a thick labial frenum, this will need to be surgically removed so that your teeth can actually come together easily. To also prevent the possibility of a relapse, there will be need to bond retainers behind your teeth after orthodontic treatment. In the case of a missing tooth being the cause of the gap, you may need to place a replacement in the form of a dental bridge, an implant, or maybe a denture. Now, if your gap is due to gum disease, you need to treat the underlying cause to stop the infection before seeking treatment options to close the gaps. Treatment for gum disease actually vary depending on the extent of infection and may include scaling and wood planing, but in severe cases require gum surgery. So now that we've talked about the common causes and the possible treatment options for diastemas, the question now will be, can diastemas be prevented? There is no way to actually prevent diastema if it is due to genetics. It's simply a feature that was passed to you by your parents and to your parents by your grandparents. However, diastema that is caused by gum disease can actually be prevented by practicing good oral hygiene, by brushing and flossing your teeth as recommended, and going for professional dental cleaning and regular dental checkups every 6 months. In conclusion, diastemas generally are completely normal and usually pose no health risk. The only concern most time is cosmetics, and if it bothers you, now you know what to do about it. But if your gap is due to gum disease, please make sure you sort it out as soon as possible before it gets worse. That being said, we've come to the end of this video. I hope that this video has been educative. Please like, share, subscribe, and turn on post notifications so that you get to know when I post new videos, and I'll see you in the next one.